When I was a little kid, my dad had cancer. So I knew at like 5 years old that I wanted to be a nurse. I worked at Kent Hospital for 20 years. I was looking for something more fulfilling. My name is Tammy Gagnon. I'm a registered nurse at Thundermist in West Warwick. Thundermist was my main goal, my main focus, because I worked with several of the providers at the hospital in labor and delivery that also work here at Thundermist, and also worked with the residents that came through the program, and just everything they had to say about Thundermist and treating their patients. The patients all loved Thundermist. In the hospital, you tell somebody, oh, you're gonna need a wheelchair or you're gonna need this. Here at Thundermist, we actually go out and get that for the patient. We make sure that they have it. And really, we don't stop until we get it for them if we can. I love the fact that we are with them for long term. Working in the special care nursery, I would take care of babies for sometimes 2 months at a time, the same baby, and that was great. But then they got healthy and got discharged and went home with their families, and I, pretty much never saw them again. So it was a lot of getting attached and then not seeing them, wondering what's happening with them. Here at Thundermist, it's pretty much, you really get to know the patient, you get to know their personality, you get to know their family members, even down to how they like to be communicated with. Like, you would see a patient's name and go, oh yeah, this one likes phone calls, this one likes texts. You get to know their personalities, who's a joker, who's more serious. And you really become part of their care team instead of just somebody who takes care of them for a short amount of time. One of the best things about Thundermist is if you have a patient that needs behavioral health at the same time, whether they be a pregnant patient, because I do work on the OB team, or if it's an older patient who may be experiencing heartache or issues at home with housing. Here at Thundermist, we have social workers that we can contact that if a patient can't afford their medication, a lot of times we can speak with a social worker or even someone in the pharmacy, see if we can get them a voucher for their medications. I have a family member who is a teenager who is transgender and is having a hard time, and I was able to reach out via email and find out good resources for that family member. It's really great working in a place where I know no matter what, I'm going to be accepted. I am Thundermist.